All right, we are live. What's up, guys? Just gonna check some things. Cool. Just testing some things here. All right. Can you guys hear me in the chat? Let me see. Show chat. Oh, there we are. All right. So what's up, guys? I am just here in the pre-show because Dr. Robbins is finishing up a surgery right now, so he'll be here shortly. So I'm testing out this new software for live streams right now. We're on it right now, so I'm gonna just practice with some things. You can see the little logo I got here in the corner, but I'm gonna see something. So cool. So it does work. Okay, so you guys can see your comments as they come up. I wanted to kind of be able to show them on the stream here. So I think that's pretty cool. I can go full screen. So I'm just messing around. But anyway, how you guys doing today? Pretty good? You guys excited? I have a lot of questions. We have literally like 2 pages of questions that were submitted. You guys in the chat are going to have some questions. So yeah, Dr. Robbins will be here shortly, and he's ready to go. I mean, this guy is awesome to come on and answer you guys' questions about limb lengthening, deformity correction, limb length discrepancy, anything you have about the procedure you can ask. So is my audio okay? Let's just do some tests here. I'm going to clip all this out, but let's see. How do you get that off? Okay. Cool. Awesome. Very cool. Pretty good. Yeah, Slender. 2 pages. It is time for a 3-hour live stream. It is. Awesome. I got good audio. Great. I'm glad to hear that. So once he gives me the once he texts me, I'll send him the link and we'll be live with him. So this is what, you know, the life of a surgeon, you know, he can get called in at any minute. So he had to finish his surgery, but he'll be here shortly. So how's everybody doing today? I'm hot. It's like 100 degrees outside here on the East Coast. I'm in Baltimore. Just check this real quick. Probably should have just waited, but I didn't want to like. Okay. We'll be here shortly. Let's see here. That's pretty cool. Cool. All right. Do you guys have any questions for me? We can get those out of the way now. Any questions that are non-surgery related, patient related? You guys, if you want any new video topics, suggestions, go ahead and send them in now. What's this? Let's see if I can get this one here. Cool. All right, good. All right. So we are going to start soon. Episode 5 of Limb Lengthening Live. Somebody's asking. Yeah, greetings to you, Jay Newton. Yeah, I can show your chat. I mean, your chat's on the screen now. I got this new little software I'm trying out. So, Mike Sierra, would you interview more doctors from India? Yeah, like, I mean, I'm doing research for international doctors right now. It'll probably take me till after Labor Day because right now I'm trying to reach out to a lot of the patients of these surgeons because, you know, I like to kind of go after the patients and see what type of results they have. Once I figure out, you know, that, and if I can figure out they have good availability, then I can definitely try to link up some surgeons in India. Because we've already interviewed Dr. Parihar from Mumbai, and he was an awesome surgeon trained by Dr. Paley. I know there's other good surgeons out there. I mean, there's tons of surgeons. I mean, literally there are gyms waiting in the haystacks out there. So we just got to reach out. So I will be doing that. I know a lot of doctors, I mean, people want me to interview doctors from Turkey, and I'm going to be doing that as well. But I'm just trying to catch up with some things. Like I said, there's a whole list of other things I was working on, some background projects for limb lengthening that you guys are going to be excited about in the future. Some really, really cool things. So, but yeah, I definitely plan to do that. Elijah Praise. Hey, Victor, my surgery had to be rescheduled for the 25th because of COVID. I'm waiting to start TRT. Though, and I'm curious, can you ask the doctor? Okay, yeah, sure. I'll add that question in. Elijah, I'll definitely add that question in. No problem about TRT. There's another question about stuff like that. I don't know where my pen is right now. Let me get my pen. Hold on. Oh. Let's write that in here. TRT Pre-surgery. All right, cool. I honestly, coming from a natural bodybuilder, you know my answer. I would say no. He'll probably say no, but anyway, I'll ask. Would it be good to get the surgeon's view considering it's not FDA approved? What is this? What, did I miss something? J Noon. Victor, are you aware Dr. Giatakis is now using the mechanical nail, the Gaucher nail? I am. I mean, ever since he started doing that, there was like 30 patients that emailed me like within the first week of last week or so. Yes, I'm very aware of that right now. Yeah, maybe I'll reach back out to Dr. G and see what's going on with him and using the Gaucher nail. I know that's a mechanical nail. It's much like I think it's like derived from the Albizia nail. I did a video way back when on that, kind of similar to the Betz bone, actually. I think it uses the ratcheting technique, and you lengthen your bones that way. What kind of, I know it's fully weight bearing. What kind of questions do you have about it? Are you thinking about it? What would make you pick the Gaucher nail over the Betz bone? Is it because of the price? Is it Dr. G's price? As I know he's probably very affordable. Oh, okay. The G nail is not FDA approved. Yeah, I have to look into that. And I think that they have different regulatory bodies over there in Europe. So I have to look into all that. Like I said, I've been backlogged with a lot of stuff, guys. But you guys have been informing me about a lot of stuff. So versus a Precice 2. Okay, so Gaucher nail versus Precice 2. I'll give you my thoughts on it. I personally, for bilateral lengthening, if you're going for cosmetic lengthening, and I'm going to assume that's what you're asking for. Hard question. It really depends on, your situation. Like if you're going to be like, by yourself during lengthening, and you can't afford to hire a caretaker, then maybe a mechanical nail that can fully, weight bear your body weight would make sense. However, personally, just because I've used the Precice nail, the original one, the mechanical lengthening, the ability to reverse lengthen if you get a delayed union, the studies upon studies about the quality bone regenerate that you get, there's just been so much research on it, so many patients that have used the Precice. I just personally like it better. That's my personal opinion. I'll try to see if maybe I could do a video on that. It'll be like mechanical nail versus magnetic nail. Jason, is there any similar study data on long-term effect? Let me just check if I've gotten a message from Dr. Robbins. No, not yet. He's probably still in surgery. Is there any similar study data on the long-term effect of leg lengthening surgery? There have been a few, actually. There's been a few people that actually sent me some stuff. In fact, there's something that somebody sent me this week. I haven't read the entire article, but I think a lot of it, they were saying that there wasn't enough conclusions, and it's weird what they were saying in that article. I kind of discarded it because it didn't really make sense. I think they were coming at it from a weird angle, but I'm gonna look at it again. But really the best long-term effect, case study that you can get is asking patients, really. I think they're going to tell you like the best long term. Let me go back up here. I'll just answer some. That's what could. Can we go to the gym again after limb lengthening and lift heavy weights? You can. In fact, going back to the gym is probably going to happen before running, jogging, jumping, most likely. Hold on, I just got something. Oh, that's hijack. But you have to wait till your bone is consolidated. And what is this going on? Stream pay. Yeah. But you can start with your upper body first. And then once the doctor, your surgeon, gives you clearance, you can go back and start training your legs, gradually. Things like closed chain movements, like feet on the leg press with light weights, high reps are probably going to be first. Doing things like leg extensions will probably come later, and then doing heavy weights will be even later, because you don't want to your soft tissues are going to be very, very weak. Like your muscles, you'll get muscle tear. When I was getting back to the gym, I got a few muscle strains and pulls from just going back to the gym and trying to go a little too soon. Even my Achilles tendon got a little bit of a partial tear, but I rehabbed it really quickly. Man's killing the weight room. Yes, I have been. I've been training hard, man, but I feel like it's going downhill. Oh, man. Let's see here. Just trying to kill some time till Dr. Robbins gets here. He'll be here soon. He's just probably scrubbing up, getting out of surgery. So how can you train cardio while leg lengthening? The only thing I've found so far is an arm ergometer. You can do stationary biking to an extent. Most likely the recumbent bike. You're at physical therapy, they're most likely going to have you use the recumbent bike. You're going to be able to do, there's a foot bike that you can use. I forgot what they call it, the QB or something like that. There's other ways to do cardio. You can do swimming, or in the pool, walk through the pool. There's all kinds of ways you can do cardio. But yeah, the arm thing, that's a great way to do it. Like the crank cycle or whatever they call that. That's a great way to do it for sure. For Precice 2, how long after surgery can I walk with a walker, and how long can I switch to crutches, and how long after lengthening can I walk without assistance? Okay, so you're just asking about the mobility progression. So after surgery, you're going to be using a walker or crutches for a while. It depends on your lengthening, how much length you're getting, which bones you're getting lengthened, what device you got done. All that is going to depend. But most likely, let's just say that you're getting the femurs done. Let's say you're getting a full 8 centimeters. Let's just say that, because everybody wants that. Then it's going to probably take you, you're going to be on crutch. And let's say it's a non-weight bearing nail like the Precice nail. You're going to probably be on walker for, let's just say, at least 15 weeks, 14 to 15, maybe even 16 weeks to be safe. And then you can probably go to crutches and walk, and then one crutch once you're consolidating. But everybody's different. Some people heal faster. It's once those cortices, you got to wait for those bone cortices to form, because that's what the doctors are looking for. If your bone formation is rapid after lengthening, then you're going to be able to walk sooner. But if it's a little slower and delayed, then you're just going to take more time. Like mine was rapid because I was doing some crazy stuff. Like, I didn't have to get, a tremendous amount of length, but I had the tibia done, which heals slower, but not for me. I did some stuff. Okay. Yes. Great one, Slender. Yes. Anti-gravity treadmill. That's another one. Alter G is another one. I know some lengthening clinics have those. I know Sinai here in Baltimore has it. I know Dong Hu Lee, I believe, has it. I know Dr. Giaticus has it. You got to just ask around and see who has that. I'm not sure if the Paley clinic has that, but just check if Robbins is here. Yeah. Okay. Let's keep going. I'll just answer some questions until he gets here. I know I'm not a surgeon, but hey, we can answer some of these other questions. All right. Where were we? No, it's just a normal text message. It's not him, not yet. Can you ask the surgeon what's his opinion on lengthening over nail femurs for cosmetic limb lengthening? As many people are selecting this method, but would it be useful for a professional point of view? As I'm skeptical. I know. Yes. Did I ask him that last time? I don't think so, but I will ask him. That's a great one. Let's add that in. thoughts on LON Femurs? Cool. Thanks for the question. All right. All right. Well, I wish you well with that. Let's see here. Okay. Did you feel any clicking or rubbing when you had the Precice in? Do you think it was because of the nail? Clicking or rubbing? Well, I had it in the tibia, so they put it through my patellar tendon, and she interlocked it with the screws, and it was a Precice 1. I don't remember any clicking or rubbing. I definitely remember a little bit more rigidity with the nail in versus when the nail was out. So, like I said, that you have two bones in your lower leg. You have the tibia and the fibula, so they're interlocked. So that I feel like they're, I don't know, it's a little bit more rigid when you have the nail in there. But as far as clicking or rubbing, I don't remember that. I was very careful. I didn't really place my foot on the floor. Dr. Conway was threatening to kill me, so I dared not to. How can I cheat my disproportion with my upper body and lower body? Well, you'd have to know your proportions. And, the surgeon's going to do like a clinical assessment when you get there. And it's more so how you look on site. Like, I know that a lot of people want to kind of calculate the numbers, and numbers do matter. But after limb lengthening, your numbers are going to be all over the place. So, like me, I have longer arms, but if I were to go get cosmetic limb lengthening done, then my proportions would probably still be okay because my arms are longer, but the numbers would probably still favor my legs, meaning my legs were longer than my upper body, but it would look balanced at the end of the day, So I guess it just matters how you look. But then you can add muscle mass, and that can shift things. It can improve the illusion. Will you be at a higher risk of breaking your bone after leg lengthening, and what would happen if you did? Would your ability to walk be permanently inhibited? No. So, well, yeah, right after limb lengthening, you will be, because like it takes even up to some people over a year to fully consolidate. Not to mention you have to get the device removed. So it could take time. So if you go on and start doing running, jumping, and like crazy, cutting moves with, all kinds of full force, then you can get like a stress fracture or a break, or something could happen. But if you're like 2.5, 3 years in, your bone is going to probably be good as new. So it probably won't be at a greater risk then. But within the first, I'd say 1.5 to 2 years, you probably have a chance. Okay, Dr. Robbins just texted. He said 2 minutes, guys, and then he'll be on. So we'll just wrap up here. But yeah, and then if it breaks, permanently inhibited, nah, bones can heal again. All right. Could we get some glute workouts for the severe lack of ass after the surgery? Sure. I'll try to record one of my workouts. In fact, I recorded an arm workout last week, and I was going to post it, but I forgot. I did that little study thing, but I'll put up the arm workout that you guys can do to build up your arms. And then, I'll just record workouts every now and then, and you guys can see what a pro natural bodybuilder does. You can kind of take and steal my regimen, which is really good. You should steal it. All right, let's take this question, then I'm going to text him. I'll say, okay. Okay, I'll send the link. Okay, let me send Dr. Robbins the link real quick. Let me go into my email. Hold on just a second, guys. We're going to get the king on, or the guy who works with the king. All right, let me just email Robbins. You know what? Let me just put it over here. Cool. All right, guys, I'm just going to copy the link over. We're going to bring him on. The one, the only. Call him the Wizard of Oz because you didn't see him last time. But then at the end of the movie, you get to see him, right? Hold on. Why is it not copying? Copy. The whole URL. There we go. Cool. All right, let me send this over to him. Okay, guys, so let's see here. He'll be coming on shortly. Another question, Victor. Selecting femur or tibia, how does one decide? Is there a protocol behind the selection and the pros and cons, long-term recovery of each? Well, tibias usually heal a little slower, and but it's going to be very independent. You'll have to really sit down and consult with your surgeon because it really does depend on a lot of things, a lot of factors, even your lifestyle. Like I just forced my tibia, which was probably a bad move looking at it now, but so most people, the majority of people do their femurs because it heals quicker. There's more muscle tissue, more blood flow, more nutrients get delivered. And yeah, so usually the femurs. Okay, so we're going to wait here and he'll be on soon. All right, guys, we're going to bring Dr. Robbins on soon. Hey, what's up? You guys like this new little streaming software? You can see your comments on screen. Is it pretty cool? Oh, we got them. Hold on, guys. I'm just going to mute myself for a second. I think so. There we go. Just text them real quick. All right. Let me just see. Okay, here we go. Clear this off. There he is. What's up, Dr. Robbins?
Hello. Hi, sorry I'm late.
No, you're good, man. You were in surgery. You're good. How are you doing today?
I'm doing very well. Thanks.
Awesome. Awesome. Thanks for coming on to the stream. So yeah, we have a full chat. Everybody's watching. People are piling in now. We have a lot of questions. Are you ready to go?
I'm ready to go.
All right, cool. Let's go ahead and get started. Can you hear me okay?
Yeah, I hear fine.
Okay. Can everybody hear Dr. Robbins okay? Just give us a chat, give us a yes in the chat, and then we'll be getting started. I just want to make sure this has good audio. All right. So Dr. Robbins, I'll start off with the first question. All right, here we go. Apparently I have a 3/4 inch discrepancy in my tibia. Not sure how much is in my femur, but it's not near as much in my tibia, and some difference in my foot. It's all on my left side. His recommendation was to make up all the difference by just lengthening the tibia. I've only seen one doctor, but I'm worried that I might affect my biomechanics by having one tibia longer than the other. I currently wear full-length shoe lifts, but would like to have the surgery as it is an inconvenience to wear the shoe lift. So basically he's asking, should he lengthen all on one side or break it up?
So a general mantra is if your knee heights, so as you stand, left knee, right knee, yours is, somewhat like this. As you stand, if your knee heights are within 2 centimeters, it's not a problem. Now, okay. How do you define a problem? Is it a functional problem or is it a cosmetic problem? And that may play into it too. If you stand right now, as you stand, your knee heights are unequal because that's the way you're built. So if you add length and make up for it, they'll still be unequal. They'll just be unequal the other direction by a little bit. Okay. So functionally, who knows what the magic number is? 2 centimeters accepted. But if you're making up 6 millimeters, do it. Now the flip side can be said too. What is your actual difference? You want to measure each of the different parts. Should you just make it up in the femur? Because lengthening the femur is preferable to lengthening the tibia if you have a choice for many reasons. Faster healing, one bone, easier to rehab, less chance for problems because of reason one, there's only one bone. So it's less hardware, quicker surgery, quicker recovery. So I see no problem over lengthening a tibia or over lengthening a femur, staying within a certain guideline, whatever that is.
Gotcha. Great answer. Okay. Next question is, I am a silent carrier of thalassemia.
Thalassemia.
Yeah. Would this condition stop me from having the surgery? Also, are there any other big health problems that would stop me from having limb lengthening surgery?
So generally, the limb lengthening population is a very healthy population. We've said it before, we'll say it again. If you smoke or vape, stop. Don't smoke, don't vape. Besides, because you want to have surgery, they're deadly, they're horrible. Nobody knows what long-term vaping does, but potentially it increases your risks for devastating complications. So quit now, don't start. If you have a condition that limits your immune system, if you have a condition that limits your ability to heal bone, if you have a condition that limits your ability to participate in rehab and be more sedentary than you are, then probably wait till those things resolve. And I'm not going to go through an exhaustive list. Right. Thalassemia, to my knowledge, there's no reason you're precluded from having surgery. We have some patients who come from parts of the world where there are conditions like that. Most people are carriers and not actively having thalassemia. So to my knowledge, there's not. Certainly, if you're not sure, because I'm not a hematologist, you can always ask your hematologist or your internist, hey, I want to have some sort of orthopedic surgery. What's the contraindication? And to my knowledge, there's not one.
Okay, gotcha. Okay. Next person is asking about, let's actually go over here. I'm 48 and I have been really fit and healthy for over 30 years, hence looking half of my age. However, I suffer from a bunion, foot fungus, and a sciatic nerve irritation. Do any of these impact my chances of having a successful surgery?
So no, but if you have back pain that's from a nerve irritation, and then you're going to stretch the nerve, anticipate flare-ups, and the flare-ups may stop your lengthening. The flare-ups may limit your rehab. Get that worked on and resolved rapidly. The bunion shouldn't. And what was this third thing? Bunion and
it was sciatic nerve irritation. But a foot fungus. Yeah.
No, but I would get. But what's the odds of you getting an infection in your surgical site from a fungus on your foot? Almost zero. But treat your foot fungus. Can I say hold on for 2 seconds?
Sure. Yeah. Go ahead.
I gotta go. I'll be right back.
Okay. Yep. Go ahead. All right, guys, so let me actually organize these questions here. This light is super bright. Turn it down a little bit. So we're live, guys, so I can't really clip it. So you're seeing this in live time. Is that better? Which one do you guys like better? Which view? Right, so let's see what question I'm going to ask next. I just see some of these chats popping up here. This is so funny. You guys are hilarious. Yeah, I can't ask that question. Exactly. He probably will. I should leave this up here. That's hilarious.
Okay, I'm back.
He's back.
All right, so I can put it to the audience. So Halloween's coming up for us in the States, and I'm doing something, and I'm growing out these sideburns for no reason at all, because I'm going to have to get a haircut and shave. So if you have any good recommendations for Halloween with sideburns and a afro, send them in. Anyway.
Send them in the chat. Put it in the chat, guys. You guys are really creative.
All right, so we talked about treating your fungus. if it's not just diagnosed sciatic, but if you have back pain or nerve irritation, lengthening your bones lengthens the soft tissues. That includes muscles, nerves, tendons, arteries, everything. So try to get that squared away because it will flare up your back, especially if you're doing any lengthening, it can flare up your nerves.
Right.
So,
okay,
cool. Next.
All right. Next up, we have a question about, have any of your patients reported hair loss as a side effect from constant X-ray radiation?
No. But there is something, and it's got a fancy name like pressure alopecia. Alopecia is hair loss. So not from these surgeries, because these are relatively fast surgeries and our anesthesiologists know to change head position. But way earlier in my career and the medical center where I trained, you do these huge tumor reconstructions or these 12-hour-long surgeries. And if the anesthesiologist wasn't constantly, at whatever rate, turning the head, the pillow your head is on pressure, you can actually get pressure alopecia, you get a bald spot. Usually it goes away, but no. The x-rays, especially now with the digital x-rays, the amount of radiation is less than it used to be. We shield your gonads. And if anything, people get more hair, which women don't necessarily like. The lengthening process increases blood flow, and so increased body hair in the area being lengthened can be seen and or reported. So not hair loss.
That's interesting. Very cool. Okay. Recently, somebody sent an article into me about periosteal resection for longitudinal bone growth in achondroplasia. Have you heard of this, and what are your thoughts on that?
Yeah. So, and I haven't read this. But as part of some of our procedures, we will release the periosteum, not just as a standalone procedure, but if the periosteum is tight. So yes, I have seen it. I think it's proven effective. But to open and release the periosteum is an open part of the surgery, and we're generally, especially for stature, our incision to do the bone cut is a quarter of an inch or a third of an inch. To cut the periosteum, it requires a big open procedure, and it has its own potential risks. On the other side of the periosteum, so the bone is here, the periosteum is the sleeve of tissue around it. You eat meat, you're a carnivore, and you're eating ribs, and you get that perfect soft rib where the meat completely comes off the bone. That under surface of the meat is the periosteum. So between the bone and the periosteum is a safe zone. There's nothing bad you can hurt. But on the other side of the periosteum are everything else. So if you're cutting through the periosteum, you could inadvertently cause a problem. So it's theoretically a good thing, but in practice,
not so good.
It's not for what we do in stature lengthening.
Gotcha. Okay. Somebody's asking about taking Finasteride for hair loss. Would that affect them, or should they stop it before surgery? Would it affect things like bone healing?
Yeah, I'd have to look. I don't know if there's contraindications. I'm sure some of our patients are taking it either reported or unreported. It's not one coming to mind that is affecting bone growth, but it's easy enough to Google it and see. Right.
Okay. Next one is, can a person with previous osteomyelitis who has a limb length discrepancy get limb lengthening done in the future?
Sure.
Yeah, they can. Okay, as long as it's cured.
So you want to make sure, and even if it's not cured, we can treat it and sometimes lengthen simultaneously. Very broad statements.
Right. They'd have to see you. Okay. Is it possible that after a year of limb lengthening to develop an osteosarcoma or develop a problem like swelling a year later when you're going home on a flight?
Okay, so to my knowledge, there has not been a sarcoma-induced lengthening, but you have to think of the numbers. Sarcomas are incredibly rare things, and in the grand scheme of surgical procedures done, limb lengthening is 0.000% of all percent of orthopedic procedures.
Right.
So the chance of a patient getting a sarcoma and having had limb lengthening are incredibly rare.
Okay.
Not that I'm aware of. And then swelling on a flight. So whether you've had limb lengthening surgery or any kind of surgery, or you're just more sedentary because you sprained your ankle, swelling on a flight is a concern for getting a blood clot. So just flight hygiene, especially if you're post-op, get up and walk, assuming you're allowed to walk. Stretch your legs, move your calves and ankles. I personally wear compression socks, even at work. I'm wearing them right now. When I fly, I wear them. And I'm 50 years old now, so I take aspirin before I fly. Not recommending that. I'm not treating you. Talk to your doctor if you should take aspirin. You may not want to because of medical issues you have, but just swelling on a plane can be indicative of a problem. Don't ignore it if it persists.
Right. Okay. Great.
You want to ask me your next question? Okay. All right.
Yep. Okay. Next up, would limb lengthening affect BMI? I know it's based off height, but would limb lengthening change it at all?
So you lose weight during the limb lengthening process, just the metabolic demands. You're not as active. If it's uncomfortable to get up, you're not going to get up and get ice cream at 3 in the morning like maybe you used to. So general guidelines, most people before they leave us, so the time they're here with us, 10, 12, 14 weeks, they're going to lose between 10 and 15 pounds, depends. Our very muscular people will lose more because the muscle loss, as you know from your injuries, muscle goes away very fast and it's very slow to come back. You will lose weight because of the metabolic demands. A year later, I'm guessing most people have regained, if not rebounded. But it's a pure equation. It's height and body. It's weight and height. You plug in the numbers and the equation changes. So adding height and decreasing weight will, by definition, decrease your BMI.
Okay. All right. That's a really good answer.
That's a cheating way to do it. If you're overweight, getting lengthening to lower your BMI is not going to make your heart any better. But your BMI is tied to other cardiovascular risk factors. So it's not a static number. You have to put it in context. So if the body fat, just being taller doesn't make the body fat go away.
Exactly. Yeah. I think the person was like, they're going to do this to fool their doctor. Like, hey, my BMI's down.
Yeah.
Okay, so this person is basically asking, how different is limb lengthening for? So the person has narrow bones, and they're wondering about the Precice nail.
Yep.
Obviously, you have different sizes that goes into it, but would the smaller nail have smaller weight bearing capacity? Yeah.
So there's 3 size nails. I'm talking Precice. It's the only one I can speak to right now.
Right.
It's 8.7. Or 8.5, 10.7, 12.5, something like that. Small, medium, large.
Right.
50 pound, 75 pound.
Okay.
So 50 pound is the bottom 2. So the diameter of your bone absolutely does play into the size of the nail. And then there's things like rod bending. Haven't had one fracture, haven't had a rod break from bending or too much weight. Okay. But yeah, smaller bones generally get smaller nails.
Okay. Very cool. All right. This person is asking about so from your limb lengthening patients, they would like to know the gender ratio, like age range and demographics of your limb lengthening patients. Like, what's the oldest patient you ever treated, essentially?
So a handful in the 60s, one of our fastest healers, wonderful, wonderful woman from California. Her husband, I think he's a PhD, a naturopath.
Wow.
He gave her so many supplements. He healed 10 centimeters in 8 weeks.
Are you kidding me? What?
5 above, 5 below. She weighed 90 pounds. Tiniest thing. He kept her so on target. He was the most amazing partner for her. He did her therapy. He was really fantastic. So I don't know what supplements he gave her, but a lot. But he healed. Yeah, so I just opened something. More than a handful of people in their late 50s and 60s. Oh gosh, I lost you. You see me there.
Yeah, I see you. Yeah.
And then the youngest is skeletal maturity. So not including patients with conditions like achondroplasia, more than a handful in their late teens. So between, say, 17 and 63, men and women, there's probably slightly more women. Okay. To me, that seems to be bimodal, meaning if we look at all of them, there's kind of 2 humps. There's like the 20-something software engineer, no family, no kids, with a lot of money and time on their hands.
Yeah.
And then there's the patient who's been thinking about it since their 20s, and now they're in their 50s, and the technology's gotten to the point, their kids are in college, they're more financially stable, and they're like in their 50s, and that tends to be more men. That's rough generalizations, but
okay.
It's the witching hour. I have
you're good.
I got to get kids to soccer practice.
Okay, we'll speed this up.
We're good. Keep going.
Okay. All right. No. Okay. Let's see here. This person's asking about nail removal surgery. So they're asking, will it be as painful as the first surgery, and how long do they need crutches or a walker after it? What's the progression after the removal?
Say again, what was the first part?
They're asking about the device removal.
Yeah.
Is it gonna, do they have to be on crutches and a walker, and for how long?
Okay, so in general, removal is outpatient, whether it's femurs or tibias or all four. In general, it's outpatient. You don't need it because of fragility, but if you're sore or unsteady or not sure, then maybe you do want to bring crutches with you, or even a walker if you're more comfortable. Your return to activity depends on what the activity is, what you had, where the holes are in the bone after the rods were removed. So if this is my leg and the rod goes all the way from the top to the bottom and the screws are very close to the ends of the bone, then it's less risky for a fracture than if the holes are kind of in the middle. Right. So if you had to do a loading type activity like heavy squats or something, the bone is at risk for bending, maybe those screw holes are a stress riser. Or if you play something with cleats, you play soccer, you're a kickboxer, you MMA battle on your weekends, there may be a return to sport over 2 or 3 months, depending what you do. But in general, outpatient surgery, you can walk that day. And if you come from out of town, most people spend the night just in case anesthesia issues, and you get on a plane and fly home the next day.
Wow. Okay. So it's fast in and out. Okay. So we had 2 last minute questions, and then we have a few in the chat. So, so this person is asking about your thoughts on lengthening over nails for the femurs, obviously for cosmetic purposes.
Right. So it's interesting. We just got an email request from a patient was asking about cost. I would like to do lengthening over nail because I believe it's cheaper. We haven't done a cost estimate breakdown, but in our minds, it's the nail plus the fixators as opposed to the Precice nail.
Right.
For people who don't know, lengthening over nail means here's your leg, you put a non-lengthening nail inside the bone. So the nail goes from the top to the bottom of the bone, inside the bone, you cut the bone, and that rod keeps the trajectory of the bone so it can only go top to bottom. It can't bend or rotate or do anything. Then a fixator is attached to the bone. The fixator is actually doing the lengthening from the outside. And when you get to length, you put screws in the bone and the rod to maintain the length, and you take the fixator off. So lengthening over nail is 3 surgeries. It's surgery 1 to put everything on, it's surgery 2 to lock up the nails, and it's surgery 3 if you're ever getting the nails out. Don't have to remove lengthening over nail because you're not lengthening nails. So maybe it is only 2 surgeries. So we believe, at least with the hardware we use, the costs are, if not more, similar. So why someone would choose lengthening over a nail above the knee and the femur as opposed to internal lengthening just doesn't make sense to me, because you don't have a fixator. Below the knee, fixator and lengthening fixators are much better tolerated below the knee. That conversation for another day. But in general, for the femurs, that is not a fun thing to go through, because we do lengthening with fixators for a lot of people, predominantly children, people with very small bones or complex deformities. And femur lengthening with pins going through your thigh muscles is uncomfortable. It's very not recommended.
Okay, not recommended. Okay. Last one of the submitted ones, and we'll take some in the chat. So this person was asking about using TRT pre-surgery. Like, how soon should they stop? This is obviously an exogenous substance, but
so TRT is testosterone replacement therapy. I don't have a great answer. To my knowledge, it doesn't affect. Again, I'm sure we have patients who are taking it. I don't have a great answer. In some sense, it's probably a nice thing because of the anabolic effects, meaning the building effects. So it probably limits your weight loss. It probably keeps your muscle mass. I can't weigh in either way.
Gotcha. Okay. All right. So let's see. All right, guys. So we're going to ask a few questions here in the chat. You guys have them. So for Dr. Robbins. So let's see here. All right. So this person is asking about proportions. Let me just actually put it on here. Oh, wait. Shoot. I clicked on the wrong one. Here it is. I don't know if you can see that on the chat, but it says I have a wingspan of 174 centimeters and my height is 169. I want to gain all the centimeters in that four lateral lengthening can give me. How much is recommended to make my arms not look small? I don't, if you know.
I'm not quite sure what you're getting at, but, but I can say it to this. Our job, speaking for us as in limb lengthening surgeons or providers or caregivers is to talk to you about what the process entails, what our expectations are, what your expectations are, what you're going to go through, and talk to you about the risks, benefits, indications, alternatives, etc. I'm not going to tell you what looks good and what doesn't look good. It's an aesthetic thing for people. I can't tell you that if your arms are 4 centimeters longer or 4 centimeters shorter, you're going to look better or worse. That's for you to decide. The nice thing about limb lengthening is it happens a little bit every day. You do a millimeter a day or 3/4 of a millimeter a day. So every week you're doing 1/4 of an inch or a 1/2 a centimeter, something like that. You look in the mirror, you put on shorts, and you say, I like the way my legs look, or my legs look too long. So you can adjust it. So it is a very rare thing for someone who's had limb lengthening, even 4 segments, to do lengthening of their arms. We've had 2 or 3 in the 7 years that I can think of who have had a humerus lengthening after having femur and tibia lengthening.
Wow, so it's really rare.
It's very rare. It's doable, but it's an aesthetic thing. So the example, and I've given it before, I think to you, is a friend of yours is going to go get breast augmentation. What size? What type? Under the muscle, over the muscle, where are the scars? Those are all considerations, and 10 women would get 10 different ones. 10 people are going to get a new hairstyle. They're probably not going to do this. But everybody gets a different hairstyle because everybody thinks something else looks good. So there is an aesthetic part of this. And I can tell you what other people have reported, but I can't give you a number to say if you're 174, 8%, or I can't tell you that.
Somebody had something about your
long-winded non-answer.
Non-answer, yeah. Here's that one for your sideburns. Somebody said Starbucks.
That's a great show.
All right, let's see here. So where we had the question here. Okay, is it possible that we first work on the upper leg and then when it's healed, to work on the lower leg? Yeah. So that's an answer.
So that's a great way to do it, and I'll tell you why that's a great way to do it. One, because the potential to get more length with the femur is obvious. It's faster healing, it's cheaper, it's easier rehab, and for all those reasons, if you do that first and recover, you may say, wow, I feel awesome, I look awesome, I'm taller than I was, I've fully recovered. Whatever that's driving me to do this height lengthening surgery, I don't need it anymore, I don't feel anymore, then you don't do it. But you have to fully recover, because we've spoken about this before. To get the rod in the tibia, you must be able to bend the knee enough to put the rod in the tibia. And if your knee is stiff from lengthening your femur and you can't get your knee bent, you can't put the rod in the tibia.
Gotcha.
So yes, you can absolutely stage them, and you'll get more height that way, because potentially you'll get up to 8 centimeters the first go round, and potentially you'll get up to 5 centimeters the second round. That's potentially 13 centimeters, as opposed to closer to 10 centimeters if you do them at the same time.
Okay. Great. This person's asking, you can see that one. Does the Paley Institute do nail removals and nails other than Precice?
Yeah, sure.
Okay. That's your answer there, Slender.
Reach out to me and set up an appointment. Send me your X-ray, and we'll talk about it.
All right. And I'll have his contact information posted after the show in the show notes. You can reach out to Dr. Robbins.
Yeah, please do.
Okay. We have a few more. We'll just take a couple more minutes to get to 6 o'clock, and then let him go because he has to take his kids to soccer practice. So this person is asking, who gets to heal faster, a slim patient or a weighted one? I mean, do I need to gain? So a lot of people have been asking me, do they need to gain weight because there's so much surgery? So
again, not a scientific study, excuse me, but I look at a lot of x-rays and a lot of patients, and in general, a younger patient will heal faster than an older patient. And I won't put that. An 18-year-old will heal faster than an 80-year-old in general, although I told you about that 63-year-old woman who healed super fast. So in general, but most of our patients are healthy. Most of our patients are concerned with their appearance and their health in general. There are very few patients having stature lengthening who are overweight or have a high BMI. For whatever reason, that's the way it is. Now, especially using Precice, where you have limited weight bearing, it's really an incentive to not be overweight, because if your weight is appropriate, maybe you're not limited. If you weigh 140 pounds and you get the largest nails, you have to use crutches and a walker for some things, but you can stand. Which is great. So if you weigh 200 pounds and your nails can only handle 50 pounds each, you can't stand. You got to always 24 hours a day when you're up. So getting your weight under control, if you're overweight, is recommended for many reasons too. Good for health, all those things. but it gets you used to exercising. It gets you used to stretching. It's kind of like prehab. I know I'm going to have this procedure and I'm going to get stiff and sore.
Right.
So if I start doing things to get me unstiff and unsore, then when I go through the procedure, I'll have much less pain and my head will be in a better space because I know what to expect.
Right.
If you've never done any kind of therapy or exercise and then you have this, you're recovering from the surgery itself and you're being stretched and your muscles don't know what to do. So the flip side, if you're super skinny and you're malnourished, well, probably lengthening isn't appropriate at this time. Get your diet in order. And if you're underweight, by whatever metric you want to use, putting on some weight before surgery is a good thing because you're going to lose 5 to 10 pounds after surgery.
Right. Okay. There you go, guys. So he just answered the weight question. This person's asking real quickly, a couple more minutes. IT band release, is it mandatory? As there are some surgeons that don't do it.
So yes and no. So the general answer is 100% of our femur patients get it. End of story. The caveat is, what if you're only doing 3 centimeters? What if you're doing 4? There's some magic number. And why do we do that? Because way back before I was doing this with Paley, so before 2014, he was doing it. He wasn't doing it on the index procedure. He was doing it if it needed to be done. And whatever the rate was, 20, 30, 40%, it's a second surgery. It's an additional cost. It's more time under anesthesia. And we think the morbidity is very low from it. So why not do it all on the front end? That being said, if there's a compelling reason, and it may be scars, I don't want to do it because of scars. Well, your chance of getting to your goal length, if it's beyond 4 or 5, is probably less. Why do I say probably? Because we've only not done it once or twice that I can think of, and the goals were 5 or less. Okay. So if you said my goal is wholeheartedly 7 or 8 centimeters, it would be a non-starter for the conversation. And if for some reason it wasn't done, it would be very strongly understood and stated that your lengthening, if you're getting tight, is going to stop. The only way to restart it is to stretch out and not be tight, or perhaps have surgery to do the IT lengthening, which we were going to do anyway. And just as an aside, when we do the IT release, we don't just do the IT release. We also release the fascia of the hamstrings, so you don't go to twofer. So that also helps with some of the stiffness as well. Okay, great. Yeah, that's why a lot of your patients do really well. Okay, so a couple more questions, guys. How much time do you have, Dr. Robbins? No, I keep going. I'm good.
You good? Okay, all right. Yeah. Well, when your kids start calling, we'll let them go.
Okay. Yeah.
How long would you suggest a patient stop quitting smoking marijuana for during the process of recovery, if at all?
That's that's tough because I don't even know if marijuana smoking is legal in our state.
Yeah. Oh, okay. Yeah.
Or the state you're in. So this isn't a legality thing. Anything you're smoking, inhaling into your lungs is crap. Don't do it.
Yeah. Don't do it.
For you. There are other ways to get the benefit or the perceived benefit of marijuana and marijuana products, such as edibles, gummies, and those things. I'm not a provider for that. I don't know. I don't have a good answer. The flip side to that is marijuana, or I'll just say, and its derivatives. So we'll lump smoking and doing the gummies or the pens or whatever you call it, do have benefits in pain control. I know that. Personal story. Anyway, so there is a benefit to it. My best friend died of colon cancer a few years ago.
Oh, sorry. And
the only thing that helped him with his appetite, keeping his weight, and pain control was marijuana. Smoking marijuana. Yeah. Anyway. So it's a whole philosophical discussion, drugs and all those things. But if you're taking things into your lungs, whatever it is, it's not good for you. It's inhibiting oxygen transport and those things. Now, if there's a way to get the chemical benefit of some derivative legally where you are, I'm not opposed to it at all.
Okay.
Hold on one second.
Yeah, sure. Yep.
I'm going to mute you while I call my.
Yep. Go ahead. I'll just eyeball some of these questions. All right, guys, so we'll probably take a few more questions. We're going to let Dr. Robbins go because he has to go.
Okay, no problem. Here's what we're going to do, because I'll answer your questions. I'm going to switch to my phone, turn off my video, and while I'm walking to my car, we'll keep going. And then,
are you sure?
Yeah, totally.
Okay, okay.
Wait for me, and I'm late. I apologize. All right.
No, that's fine. All right, guys, he's going to give you guys more time.
No, we'll make this work.
All right. I'll read them out loud to you then.
Okay, let me get on to my. I'm opening it on here. All right, allow. Join. Me.
What's the estimated time before you get to your destination?
I'm walking up. Right? Hold on one second. Yes.
There we go. Okay, I got you on the phone, and then you can turn off the camera. Okay, cool. All right, let me just see if we can get his ear. All right, let me just turn off his, there we go. All right, guys, so it's going to be me shown. Let me just get him on audio. We can't hear you, Dr. Robbins. Let me chat to him real quick.
Working or not working?
There we go. It's working now.
All right.
Perfect. We're all set. Okay, so can you hear me?
Yep, I hear you.
Okay. The question is, I have Achilles tendinitis after a partial rupture 4 years ago. It only gets tight at night, and it does not affect me during any activity. Will this affect lengthening in the tibias or the femurs?
So it definitely will not affect lengthening in the femurs.
Okay.
If you're having tendinitis, like an actual ongoing thing, I would get that fully resolved before I would do any lengthening below the knee. Why are you getting tendinitis? Is it because you're so tight still? Is there a lot of scar tissue and adhesions? I would hate for you to go into a procedure that is already has potential complications of getting stiffness if you're not doing it appropriately, and then you get stiff or you have to limit your lengthening. And I want to be clear. We're not going to lengthen you if you get stiff or let you lengthen to a point that you can't recover from because you stay here lengthening with us at the Paley Institute. But if you're at a place where you're lengthening from home and you're not having follow-up at whatever other institute you may go to, you may get caught behind because you get more stiff on top of the tendinitis.
Gotcha. So
I would get that fully resolved before you would entertain having an elective procedure. That's a lot of time and money. And what if your goal is 5.5 centimeters and you get 2?
Exactly.
So stack the deck in your favor.
All right, there you go.
And 5.5 is not a goal I like for the tibia, just by the way. I keep having all my caveats.
Yeah.
I like 4.5 better.
4.5. Yeah, you're the sub 5.
I like 3. 3's the best. Less is more.
In fact, we actually have a question about that right now. Somebody's asking basically, why is it so difficult to lengthen the tibia over 5 centimeters? Is it the Achilles tendon or is it just the tissue down there?
It's not difficult, that it's more challenging for you, the user of the machine. It's difficult because, and we've spoken about this before, if you look at your leg, you bend your knee.
Uh-oh, I think we lost Dr. Robbins. All right, I'll try to get him back on. Let me just shoot him a message real quick on WhatsApp. Sorry, guys, I caught him at a bad time. I didn't realize. Let me get him back on here. Lost, yeah. All right, give it a minute. He'll be right back while he drives. He's probably getting in his car and his Bluetooth probably swapped out, I'm guessing. Just give it a second. You guys have some good questions in here. I see this. This is really good. By the way, I want to thank all you guys for showing up. I mean, this is really awesome. I really appreciate it. It's getting bigger and bigger each week. We'll see if he comes back on in a second. Just give him a minute. He's driving probably, so. Hey, what's up, Thorfinn? How are you doing? Just going through some of these. Can I ask Dr. Robbins about the mechanical nail? Sure. Well, let's see if we can get him back on. He might still be talking and not realize. Oh, here he is. He's coming back on.
You hear me?
Yeah, I can hear you. You're back on. We lost you for a second.
I gave the best answer on lever arms ever. I don't think you heard it.
I figured you were still talking. Oh man, sorry about that.
Let me turn on. Hold on. Let me turn on my car.
Your Bluetooth? Yeah, your car Bluetooth was awesome last time.
Okay. Hold on. Trying to go hands-free.
Okay.
All right. What did you hear me say?
So we heard you say that it's not as difficult. You were just starting the question pretty much, and then we lost you.
Okay. So I'll say it again. So imagine you're looking at your leg.
Mm-hmm. Oh no! Did we lose him again? Can you hear us, Dr. Robbins? He's still here.
Okay.
There it is. Okay, we got you. There, that's awesome. We can see him too. Okay. Well,
do you hear me?
Yeah, we can hear you.
Okay. So imagine you look at your own leg and you're lengthening your femur, and your knee, the tendencies for your knee to get stiff, so it gets challenging to flex your knee. So a therapist wants to bend your knee. He or she can grab down by the ankle and push, among other things. And they get a long lever arm. They have the whole length of your leg below the knee to push. It's like if you're trying to loosen a lug nut on a car, if you have a little wrench or a big wrench, it's much easier with a big wrench because the handle's longer.
Okay.
So the handle, your leg, for rehab when you're lengthening your femur is a much longer lever arm. Now look at your foot relative to the length of your tibia. Your foot is much, much smaller. So the lever arm, because the length of your foot is small, is much shorter. So getting a good stretch of your Achilles is much more difficult below the knee at your ankle because your foot is so small. The lever arm is smaller. So that's why. Plus,
that's why.
There's two bones. There's the tibia and the fibula.
Yeah.
So what if one goes faster or slower? Just more.
Mm-hmm.
Just more.
Okay, more. Okay, well, that's a really good. So it's a physics answer right there. Oh, that's awesome.
Yeah, exactly. Yeah.
Okay, all right. So we'll take a few more guys. Let's see here. Somebody's asking, can you gain length from a bowleg correction, and if so, how much could you expect?
So that's simple geometry. You draw out two sticks representing your legs, and you draw the angle 15 degrees. And you measure from the top of the stick to the bottom of the stick. And then you straighten it out and you measure from the top to the bottom. So it's negligible, but you do get some. Maybe it's a centimeter.
Okay.
You get a little bit of correction from that.
Oh, that's awesome. All right. Very cool. So you do get some height from your bowleg correction. Okay. Next question is COVID?
You get a little bit of free line. Yeah.
Okay. Somebody's asking, is the COVID vaccine necessary for rod removal at an outpatient clinic at the Paley Center, I guess?
So vaccination is not required for anything. And even if you have been vaccinated, our hospital and our surgery center, which are independent, have their own rules and regulations for preoperative testing that change frequently. So I could direct you to Angelique and to get the latest update, or Sylvia. So vaccination is not mandatory, but preoperative testing is.
Okay.
Even if you've been vaccinated, everyone gets tested according to the same protocols.
Okay, gotcha. All right. Awesome. All right. So let's see here. I think somebody said it's all good. Life of a surgeon / dad. So they understand. That's awesome. Awesome.
I'm taking my second kid to college. My second kid starts college on Monday.
Oh, really? Starting college on Monday?
Yeah. My daughter, who was on our first call, just started her second year. And the one who I was just talking to, my baby, just started his sophomore year.
Oh, man, that's awesome. Congratulations.
Yeah.
They're moving through the pipeline.
Yeah.
All right. Next question is, when is the Stryde nail going to come back? The most popular question.
No, I don't have an answer.
He doesn't have an answer.
Haley may have more information. Right now, it's not today. That's literally my answer.
Okay.
Unfortunately, there's I got nothing else.
Okay, gotcha. So let's see here. A few more. We'll just do. All right, guys. We're gonna take 3 more questions. So go ahead and pop them in the chat if you have them. Somebody's asking about mechanical nail opinions. This has been really popular lately. I'm not sure if you've heard of it. Another surgeon is basically using another surgeon's nail that's mechanical ratcheting, lengthening, and they just want to get your thoughts on the mechanical nail versus a magnetic nail.
So I have personal experience with 3 families of nails. One is the ISKD, which is off the market. That's called the internal skeletal kinetic device, which is a ratchet type nail. And then the Precice and then the Stryde, which are pretty much the same, mechanistically speaking. So I did a small handful, probably under 20 ISKDs. And on average, my return to surgery rate was probably more than 50%. So why are you returning to surgery? For nails that wouldn't lengthen. So the way a ratcheting nail works, at least the ISKD, and there may be much newer ones that are easier. For those of you who don't know, imagine you're lengthening your femur. So there's a rod in your femur and the bone is cut. And the way the ratcheting nail lengthens is you have to actually rotate your bone around the nail where the bone is cut by a certain amount, 15, 20, 25 degrees. So you hold your leg, you're sitting in a chair with your leg dangling, you hold your thigh above the bone cut really tight, and someone below you takes your knee, your bent knee, and they rotate your knee backwards and forwards, and the nail rotates, and the rod rotates, and that affects lengthening. Wow. So, how uncomfortable is that? I don't know. The problem is rate control. So what if you move a lot in your sleep? What if you fidget sitting at your desk? Who knows? You don't know when the lengthening is occurring. Yeah. So you may over-lengthen, which is bad for bone healing. It's bad for your nerves. What if you don't lengthen enough? You do all the right moves, and then you go back a week later, take an x-ray, and nothing's happened. So you may consolidate early. So the problems that we got the job done, but you could get a runaway nail. You forget to come back, you're lengthening too much, and you just lengthen 8 centimeters and only wanted 3. Well, there's an easy way to fix that. If they only need 3 centimeters and the nail goes to 8, and you pre-lengthen at 5, and then it can't go beyond, which is a simple thing to think about, but you can do that. So that's my experience with ratcheting nails. I have nothing against them at all. So the questions to ask your surgeon are, how do you control the rate, and how do you ensure it's working, and how uncomfortable is it? I mean, at some point, the week after surgery is probably much more uncomfortable than 2 weeks after surgery because your muscles aren't as sore and you've recovered from the surgical pain. But those are the things that I would want to know. Rate control, how do you stop it? What if you go too much? Yeah. So Precice and Stryde, you turn the machine around and you go backwards. So can you shrink if you need to? Wow. So those are the things that immediately come to mind when you talk about a ratchet nail.
Okay. All right. Awesome. All right, guys. So we are going to, I will take one more question here. We got, and then we're going to let Dr. Robbins go because he's been so awesome to come on today. Busy day. So Logan X is asking for consolidation with the Stryde nail. He has the Stryde nail apparently. What is the optimal number of steps that maximize consolidation but minimize corrosion?
That minimize corrosion.
Yeah, corrosion. Yeah.
There's no answer for that.
Okay.
So when we looked at a time and we looked at a number, and it's been so long since I've looked at it. I think George did a 1-hour talk with you and he went through all of our statistics. So if I misspeak, I refer you to your other excellent podcast where I think he even showed you the PowerPoint slides and examples, if I remember right. So I refer you to that. But in general, what we found was patients who had 2 legs done at once, which is generally stature patients, had a higher percentage of getting more of whatever this was. More bone, more robust bone at the junction was the most common thing, and a very small percentage had a small amount of lysis. So there was something happening to the bone in a majority of patients, and the vast majority of those changes were more bone. So could we then correlate how much of a bone change there was with the gross appearance of the nail? Not really, because we take a lot of nails out and we look at them and see, could I look at a nail that came out and predict what the x-ray looked like? No. Could I look at an x-ray and predict what the nail would look like? No, I cannot. So what we're offering to our patients who have a Stryde nail is, in general, we say you take the nail out in a year. Well, what if you're healed enough and it's only 7 months? Well, okay, let's get them out early. Yeah. So what if you're getting a lot of reaction and you're worried and your bone isn't quite fully healed enough that will let you go walk unprotected? Maybe we'll put a different nail in to give you support and stability that never has to be removed while you fully recover. Okay. So there are options, especially if you're having corrosion or you're having a lot of bone reaction and it's bothersome to you. There are certainly lots of options we can discuss on getting the nail out.
Okay, great. Okay, awesome. Well, all right, guys. So that is Dr. Craig Robbins from the Paley Institute. So you guys show him some love and type in the chat. Say thanks to Dr. Robbins. I'm gonna let him go because he has to take his daughter to soccer practice. So we're gonna post all of his contact information under the show. So if you guys want to reach out to Dr. Robbins, you can do that there. And Dr. Robbins, we want to thank you for coming on and answering all these questions.
Yeah, of course. And now I get to get on my little soapbox for you for a second. Victor doesn't know what I'm about to say. I think he'll be thankful. But for those of you on the forum, if you haven't taken a moment to look beyond just the stature stuff, I want you to take a few minutes and read Victor's story, and I want you to know why he calls it cyborg for life, what the number 4 is for. Because it's important. He talks about body, mind, spirit, and he talks about, sort of the holistic approach to surgical and rehab. And we've spoken about it, but it's worth saying again, just to decide you want to have surgery, limb lengthening or some other elective surgery is a big deal. You really have to know what you're getting yourself into, and as prepared as you can be psychologically and your mental health, especially in this pandemic and times of uncertainty, the more you can get your head space clear and really be in tune with what's going on before your surgery, your recovery and your journey will be so much more enjoyable and so much better than if you're not prepared. You may have all the money in the world and all the time in the world and be the most healthy person in the world, but if your headspace isn't good and you don't really truly understand what you're getting yourself into, it's going to be more challenging than if it's the converse. So read Victor's story, read what Cyborg for Life is all about, because I think he had a great message, and I just wanted to give him props for that. And
thank you so much. I really appreciate that.
Yeah.
I really do. And by the way, at the very end here, they just, I'll clip it and send it to you, but they just all said, thanks so much, you're the GOAT. And one guy said to be a surfer guy for Halloween.
Excellent. So, Starberry and surfer guy. You had to think about the Starberries. All right. I'll talk to you soon.
All right. Have a good one, Dr. Robbins. Take care, man.
Thanks. Bye, guys. Bye. And girls.
All right. Awesome. All right, guys. So we just had Dr. Robbins on. I know he had a surgery, a late surgery, and he had to go take his daughter to soccer practice. So sorry for the audio at the last minute there, but he had to get going. But yeah, guys, I want to thank you all for coming on to join the Limb Lengthening Live. Again, these are really, really helpful for patients. This is something that if you're thinking about stature lengthening, thinking about discrepancy fixes, deformity correction, these are going to be really helpful going forward. So next week we actually have a scheduled patient coming on. He's going to come back. He's coming on to talk about his bilateral femoral lengthening. He's getting stature lengthening done. He's coming on next week, 5 p.m. same day, Thursday, because that's my easiest day. And then, and then I think the following week we have our physiotherapist come back on. And then the following week, I'm going to try to get on another surgeon. We're going to branch out. We're going to maybe get one of the surgeons that you guys recommend. So yeah, so I want to thank you guys for coming on. Yeah, Big Man Stevens, I want to thank you, Jay Newton, everybody for coming on, Slender. Yeah, so so if you guys have any questions for me or suggestions, just leave them in the description, the comments, and I'll check them out later. And I'll try to have the timestamps up. It'll be a little jumpy because at the end the audio got a little hard, but I think most of you guys got the message across. So yeah, thanks so much for coming on, and I'll see you guys next time. Yeah, ET. Thank you. All right. See you guys next time.